Happy Thanksgiving. My name is Ross Mason, and I'm the founder of HINRI, the High Impact Network of Responsible Innovators. We are a venture philanthropy. I have done HINRI for the last 17 years as a volunteer, which I created to combine my experiences as an angel investor in Silicon Valley with my work in Africa in a hospital where 86% of the patients had AIDS. I wanted to combine the compassion, love, and community I experienced in Africa with the drive, innovation, and entrepreneurship that I saw in Silicon Valley, working with some of the world's leading high-tech executives, angel investors, venture capitalists, and entrepreneurs. And I wanted to bring that approach to philanthropy and create sustainable charitable annuities by buying and partnering with businesses. And we've solved one problem after another. I'd encourage you to look at our website, the High Impact Network of Responsible Innovators, HINRI.org, HINRI.org. And as I stepped into the world of philanthropy, I saw one disturbing situation after another. And you can see our 5 values, and those were crafted, those are on our website, to address the things that we were seeing, really of toxic philanthropy. But let me give you a few quick examples. The Clinton Global Initiative and the American Red Cross raised $500 million to build houses in Haiti after the earthquake and the terrible disaster, natural disaster, and the corruption that followed, people starving, etc. With $500 million, they built 6 houses in 5 years. We partnered with a nonprofit called New Charity Story that was the 4th nonprofit to go through Y Combinator. We raised $600,000 and built 100 houses in Haiti in 2.5 months. Where would you rather invest your philanthropic dollar? $6,000 per house or $83 million per house? Which would you rather invest in? And we saw the same thing when I met with Admiral Mullen. He talked about the Wounded Warrior. He said, "Do you have anything to do with the Wounded Warrior Project?" And I said, "No, sir." He said, "Good, my office, the U.S. military, the Joint Chiefs, we want nothing to do with the Wounded Warrior Project." This was 8 or 9 years ago. They have 40 lawyers whose only job is to sue other nonprofits who use the term Wounded Warrior or who have a silhouette in their logo or their advertising. They're spending 61% of their budget on themselves. They're going helicopter skiing. They're having cocaine parties with strippers. They're making veterans victims. And we will have nothing to do with the Wounded Warrior Project. They've since gotten a lieutenant general and turned it around. But everybody in America, as we work with veterans, as we're doing suicide prevention, partnering with Augusta National and a vocational platform, Jack Nicklaus and Tom Cousins launched, now partnering with Major League Baseball to be a safety net for all the nonprofits. So a veteran can call within 24 hours. We get them everything they need, send them to the need or address the need, and they don't have to navigate the system. That's exactly what Admiral Mullen asked us to do. We've seen it in education, where with Valley Christian schools like Khan Academy, we're providing a free world-class education to 2.5 million students in over 10,000 schools in 10 Latin American countries. We're launching that in India. We're launching that in Africa. Same with Jacob's Ladder and special needs, where people are spending tens of millions of dollars. And we are having people jump 8, 10 grade levels in some instances, and in many cases, 4 to 5 grade levels in 6 months. And Harvard Medical School has said we're 20 years ahead of anything they've ever seen. Bernie Marcus, who's given over $100 million to his Marcus Autism Center, his family said we were 20 years ahead. So those are the kind of charitable initiatives we're engaged in. And about 4 years ago, I was approached by a donor who wanted to pay for an event for spinal cord injury. I was injured 3 years after I started HINRI. And I realized going through my injury in 2007 how truly broken spinal cord injury is. The way it works is you're either declared a complete or incomplete based on whether you have function or sensation below the injury in the first 2 or 3 weeks. In the United States, they teach you to be disabled if you're a complete injury, meaning no function or sensation below the break. If you're an incomplete injury, then basically if you demonstrate movement, then you'll get therapy. So for example, in China, the standard of care is walking, for all spinal cord injury, walking 6 hours a day, 6 days a week for 6 months, all spinal cord injury, 100% paid for. In the United States, you never walk again if you're a complete injury. You walk 1 hour a week for 4 weeks on a Locomat like I've got behind me if you're an incomplete. I had a young man live in my basement for 5 years who was a complete. He walked 650 miles in less than a year on this Locomat. And it doubled the size of his legs. It restored his bowel bladder sexual function. He started getting activity in his quads. He'd never have that opportunity in the United States. He also had a brachial plex injury. He partnered with a Mayo Clinic. They told him to amputate the arm. He's now restored a third of the function sensation for that arm. And he got a federal judge to change the standard of care. For the brachial plex injury, we're changing the standard of care for locomotive training, but we want to change the standard of care for all of spinal cord injury. Here's the problem. The insurance industry has lobbied Congress to get all spinal cord patients other than veterans placed on Medicare or Medicaid, depending on their age, 2 years after injury. So they don't bear the long-term consequences of short-term decision-making based purely on money. So, and then they start lobbying Congress to change what's paid for. So you don't get access to your home, that's medically unnecessary. Access to a toilet or shower, medically unnecessary. This young man I'm talking about, completely paralyzed, 1 arm and 2 legs, can't feed himself, can't turn himself. He had 28 other injuries. You could touch his skeleton with 3 fingers. He only qualified for 9 hours of caregiving a day through Medicaid. So he had to decide, do I want to eat or turn at night? Either one of them was going to kill him, very short term. So I had him move in with me. The only way, so the only group that's on the hook for the long-term care of a spinal cord patient in the U.S. is the U.S. Veterans Administration. They don't hand it off to Medicare or Medicaid. They are very compassionate. They have 24 spinal cord injury centers across the United States. They have 26,000 plus or minus patients, just north of that, patients with spinal cord, almost 3,200 quadriplegics. Just the quads are costing them $515 million a year, $11 billion for the lifetime care of those quads, even if they never have another veteran injury. They have a financial incentive to transform the standard of care. So our chairman, General Larry Ellis, is a retired 4-star who was paralyzed from his collarbones down at 68. So we partnered with General Ellis, signed a memo of understanding with the Veterans Administration, and I spent years, 6 years to be exact, on the board of Praxis, formerly the Rick Hansen Institute. I was in charge of clinical trials, the board member who chaired commercialization for them, and I helped Praxis set up what is now the world's largest research and clinical trial network for spinal cord injury. It's over 36 of the best universities in the world: Oxford, Cambridge, the leading universities in China, India, New Zealand, Australia, Africa, all over North America, of course, Latin America, all over the world. 22 centers in China are part of a clinical trial network. We changed the standard of care for spinal cord injury in Austria with a shockwave therapy that restored a third of my sensation and function down to the waist after 6 8 to 10 minute treatments. We can't get anybody to use that in the United States. It took us $30 million and almost 15 years to get that FDA approval in the United States. It's been the standard of care in Austria for a decade within the first 24 hours. The same thing in China. We're doing innovations there with laminectomies and umbilical cord implants that have gotten over 75% of complete patients walking. We went to one of the leading spinal cord injury hospitals in the United States who just raised $218 million. And all they're going to do is build a nicer parking deck and more buildings and write research papers to raise more money that do not impact patients. We've tried to bring them one innovation after another. They said, we have no interest in a cure for spinal cord injury. We have no interest in working with chronic patients. We have no interest in working with complete patients because we don't get paid for any of that. We have a 2 to 4 month window. We have limited resources. We focus on the acute phase, that first 2 to 4 months, and incomplete patients. That's all we care about. If you want to help us manage nerve pain, we'll talk to you. And that's what you encounter over and over again if you're on the inside. So we, through that clinical trial and research network, identified Dr. Reggie Edgerton, and he was doing first epidural stimulation, which you do an implant, and getting people walking again. And that was the first clinical trial the VA has ever done with one of his students, Susan Harkema. And we're now doing transcutaneous, which is through the skin, getting the same or better results. He got the first 12 out of 12 patients walking either with a walker or walking again before he worked with us. With the first 2 patients that have gone through our program, which got interrupted by COVID, we've taken them from an ASIA A, which is a complete injury, no function or sensation, to an ASIA C. ASIA E is totally healthy. ASIA D is walk but not run, and you can't even tell the person's injured. So ASIA C is starting to walk with a walker, or some cases without a walker. So Dr. Edgerton has agreed to do a clinical trial at the University of UCLA, at University of Southern California, Georgia Tech, and Emory. Emory's doing a $1 billion neuroscience campus. They've asked us to be the spinal cord injury partner. I'm letting people use my home, this Locomat, my endless pool, this All-Core 360. I've got the same equipment that the leading spinal cord injury centers across the country have in my basement now. But the difference is complete patients get access. We have 24/7 access, and we can drive innovation and demonstrate what success is. Finally, we have partnered with the X Prize. So we've signed a memo of understanding with the VA to partner with them on clinical trials because they're the only partner that's driving towards a cure for paralysis in the United States. Certainly Praxis is doing it outside the US, globally, out of Canada. But the VA is the only partner that really is focused on getting people out of wheelchairs. So we're partnering with them on their 24 centers. We're partnering with Dr. Edgerton on this clinical trial, and we signed a memo of understanding with the X Prize. The X Prize has awarded $99 million of prizes, which have resulted in over $2 billion for that $99 million in pursuit costs, IP, launch of new technologies. So it's on average a 20x return. We'd like to do a $10 million X Prize at a minimum. We believe that'll result in over $250 million of investment focused on a cure. Shirley Ryan, Abilities Lab in Chicago, has raised over $500 million for a cure. The Miami Project, over $500 million for the cure. UC Irvine, where Christopher Reeve sent the money he raised, $400 million. Shepherd Center raises $100 million a year. They've just done they're doing a $300 million capital campaign right now here in Atlanta. We want to force them to compete against each other for a cure and take that money that's been raised. And I understand that they're focused on what will be paid for. They don't want to be sued. They don't want to lose the ability to help and serve patients during the trauma of their injury, during the initial recovery. But somebody's got to step in, like angel investors do in Silicon Valley, and take the risk. I mean, it's great if you've got an Air Force, a Navy, an Army, if you have special forces, but somebody's got to do bomb disposal. Somebody's got to go beyond disarm, explosive situations so the rest of the theater can operate in that ecosystem. Somebody's got to drive innovation. That's what we want to do. So in conclusion, I hope you'll join us in that journey. I'm opening my home. I am part of the UCLA VA clinical trial. I hope you'll watch the next video where Kelly McCutcheon will get into a little bit more specifics about this journey. But again, happy Thanksgiving and God bless you. And I hope you'll partner with us. We're raising an additional $250,000 to complete the first phase of our clinical trial. We welcome anyone who wants to participate as a donor in that journey with us. Don't hesitate to reach out to me, Ross at HINRI.org. Again, Ross, R-O-S-S, at HINRI.org. Or you can call me on my mobile, 404-775-0404. Again, 404-775-0404. God bless you and happy Thanksgiving.